All right, so today we are going to be taking a deep dive into contact lenses.
Okay, sounds good.
And this is something that, I personally have worn contact lenses for a long time, but it seems like there's a lot more out there than when I first started wearing them.
Oh, absolutely. The technology has advanced so much, and there are so many more options available now.
Yeah, and you sent me over a bunch of cool resources, including a guide from the CDC, which is great. I think that's a really good source to kind of start with.
Yeah, definitely. They always have the latest information and recommendations, so it's a great place to get a foundation.
So let's dive in. I think the first thing that jumped out at me from the CDC guide is that all contact lenses require a prescription.
Yeah, that's super important. I know it can be tempting to think, oh, it's just a little piece of plastic, but
Yeah.
it's a medical device that sits directly on your eye, so you really need to make sure it's the right fit for you and that you're using it safely.
Makes sense. So we're talking about all types of contact lenses, right? Even those just for cosmetic reasons, like the ones that change your eye color.
Absolutely. Even if you're just going for a temporary change in appearance, you still need a prescription. Your eye health is too important to take risks with.
Okay, so prescriptions are a must. No shortcuts there. Now let's talk about the different types of lenses themselves. The CDC guide breaks them down by material, wear schedule, and how often they need to be replaced.
Right, let's break it down. Starting with the material, you've got two main categories, soft lenses and hard lenses, or what we call rigid gas permeable lenses, or RGPs for short.
Okay, so soft lenses first. Those are the ones I'm familiar with. They're like, little tiny flexible discs, right?
Yeah, exactly. They're made from these flexible polymers that allow oxygen to reach your cornea. That's the clear front part of your eye, and it needs that oxygen to stay healthy.
And that's why it's so important to follow those care instructions and not sleep in them
Yeah.
if they're not designed for overnight wear, right?
Absolutely. Sleeping in the wrong type of lenses can seriously disrupt that oxygen flow and increase your risk of infection.
Okay, so soft lenses are the most common, I'm guessing.
Yeah, they tend to be more comfortable, especially for first-time wearers, so they're definitely the most popular choice.
Makes sense. Now, what about those hard lenses, the RGPs? Are those like the old school hard contact lenses that people used to wear?
They're actually evolved from those early hard lenses, but they're much more advanced. They're still made from a firmer plastic, but it's oxygen permeable, so your eye can still breathe.
Okay, so how do they compare to soft lenses in terms of comfort and vision?
Well, some people find the initial adjustment period a bit trickier with RGPs because they are, firmer. But many people who wear them say they offer sharper vision, especially if you have astigmatism.
Astigmatism, that's when your eye isn't perfectly round, right?
Exactly.
Yeah.
And RGP lenses can sometimes correct that better than soft lenses, at least for some people.
Interesting. So it sounds like it's a bit of a trade-off. Softer lenses might be more comfortable at first, but those RGPs could potentially give you clearer vision.
Yeah, that's a good way to put it. It really depends on your individual needs and preferences.
Okay, so we've covered the two main materials, soft and hard. Now, let's talk about wear schedules. The CDC guide mentions daily wear and extended wear. What's the difference?
So, daily wear lenses are pretty straightforward. You wear them during the day and take them out before bed.
Okay, that's what I do.
Makes sense.
Yeah, okay.
Now, extended wear lenses are specifically designed to be worn overnight, sometimes for up to a week or even longer, depending on the type.
Really? So you can sleep in those?
Yes, but it's really important to follow your eye doctor's instructions carefully because even extended wear lenses need to be cleaned and cared for properly, and not everyone's eyes are suited for overnight wear.
Makes sense. So you're saying even if a lens is designed for overnight wear, there's still a specific routine to follow. You can't just pop them in and forget about them for a week.
Exactly. Hygiene is always crucial with contact lenses. You're putting something foreign on your eye, so you need to be diligent about keeping them clean to prevent infections.
Okay, no sleeping in daily wear lenses and follow the care instructions for extended wear lenses. Got it. What about those daily disposables? Are those literally just wear them once and toss them?
Exactly. You wear them for a single day and then throw them away. No cleaning required.
That sounds pretty convenient. So what's the catch?
Well, the key here is disposable. Don't try to stretch their lifespan. If you wear them for longer than a day, you increase your risk of discomfort and potential problems.
Got it. One and done. So what's the other option for replacing lenses?
Planned replacement. These are replaced on a schedule set by your eye care provider.
Okay, so it could be weekly, every 2 weeks, monthly, something like that.
Yeah, it really depends on the specific type of lens. Your eye doctor will recommend the best replacement schedule for you.
So a bit more responsibility with those compared to just tossing them out every day.
True, but some people prefer the routine of cleaning and caring for their lenses. It's all about personal preference.
Okay, so we've covered soft and hard lenses, daily wear and extended wear, disposable versus planned replacement. But the CDC guide also mentions some special types of lenses, and I have to admit, those sound pretty intriguing.
Oh, yeah, those are the fun ones. We're talking about things like hybrid lenses, ortho-K lenses, scleral lenses, all sorts of cool stuff.
All right, let's break it down. Hybrid lenses first. What are those all about?
So remember how we talked about hard and soft lenses? Well, hybrid lenses are kind of like a combination of the two.
Oh, interesting. So you get the benefits of both.
In a way, yeah. They have a rigid gas permeable center for crisp vision and then a soft outer skirt for comfort. Kind of like the best of both worlds.
Okay, so why wouldn't everyone choose those?
Well, fitting hybrid lenses can be a bit more complex, and not all eye care professionals have the expertise to do it, so they might not be as readily available as traditional glasses.
Ah, so it's like a specialized type of lens.
Yeah, exactly. They can be a great option for people with certain eye conditions, like irregular corneas, but you might need to find an eye doctor who specializes in fitting them.
Okay, makes sense. What about those ortho-K lenses? Those sound almost too good to be true. You wear them at night, they reshape your cornea, and then you can see clearly during the day without any lenses.
Yeah, it's pretty cool. The effects are temporary, though, so you need to wear them every night to maintain the correction.
But for someone who hates wearing glasses or contacts during the day, that could be a game changer.
Definitely.
Mhm.
Especially for athletes or people with active lifestyles.
Okay, so 2 down, 1 to go. What about scleral lenses? What makes them different?
So scleral lenses are larger than typical lenses and cover a greater portion of the eye. They're often used for people with specific eye conditions like keratoconus or severe dry eye.
So those are even more specialized than hybrid lenses.
Yeah, you could say that. They're definitely not for everyone, but they can be a lifesaver for people with certain eye problems.
Wow, so it's really amazing how many different types of contact lenses are out there. And we haven't even talked about the colored or decorative lenses yet.
Oh, right. Those are definitely popular, but it's important to remember that even decorative lenses require a prescription. You should never buy those over-the-counter colored contacts you might see online or in some stores.
What's the risk with those? I mean, they're just changing your eye color, right?
Well, any contact lens, even a colored one, is a medical device. If it's not fitted properly or if it's made from materials that aren't safe for your eyes, you could end up with some serious problems.
Like what?
Infections, corneal abrasions, even vision loss in some cases.
Wow, I didn't realize it could be that serious. So even if it's just for a costume party or something, you still need to go through the proper channels and get a prescription for those colored lenses.
Exactly. It's not worth risking your eye health for a temporary change in appearance.
Okay, so we've covered a lot of ground here. Different materials, wear schedules, replacement options, and those specialty lenses. It seems like there's a lot to consider when choosing the right contact lens.
Absolutely. Your individual needs, your lifestyle, your budget, it all comes into play.
So how do you actually go about choosing the right type of contact lens? Is it just a matter of preference, or is there a more structured approach?
Well, that's where your eye doctor comes in. They're like your guide through this whole process.
Okay, so it's not like just going online and picking out whichever ones sound cool.
Not exactly. Your eye doctor will do a comprehensive exam to assess your vision needs and your overall eye health.
So they'll check your prescription, of course.
Right. But they'll also look for any other eye conditions that might influence your choice of lenses. And they'll ask you about your lifestyle, too.
Lifestyle, how does that factor in?
Well, if you're someone who's very active, for example, they might recommend a lens that's designed for better stability and moisture retention.
So a lens that won't dry out or pop out easily when you're sweating or moving around a lot.
Exactly. And if you're someone who travels a lot, they might suggest daily disposables so you don't have to worry about packing cleaning solutions and lens cases.
I can see how that would be super convenient. It sounds like choosing the right contact lens is really a personalized process.
It definitely is. There's no one-size-fits-all solution. Your eye doctor will work with you to find the best option based on your individual needs and preferences.
Okay, so let's say you've gone through the whole process. You've got your prescription, and you've chosen the right lenses. What happens next?
Well, that's when the real fun begins. You get to learn how to put them in and take them out, and you'll get instructions on how to care for them properly.
Oh, yeah, that's right. Putting in contact lenses for the first time can be a bit of a challenge, can't it?
It definitely takes some practice, but don't worry, your eye doctor will show you the ropes. And once you get the hang of it, it becomes second nature.
I remember when I first started wearing contacts, it felt so weird having something on my eyes.
It's a strange sensation at first, for sure, but most people adjust pretty quickly.
Okay, so once you've mastered the art of putting them in and taking them out, what about the daily care routine? What's involved in keeping those lenses clean and safe to wear?
That's a crucial part of wearing contact lenses. Your eye doctor will give you specific instructions on how to clean and store your lenses properly, but it usually involves using a special contact lens solution.
So it's not as simple as just rinsing them off with water.
Definitely not. Tap water can contain microorganisms that can be harmful to your eyes. You need to use a sterile solution that's designed to clean and disinfect your lenses.
Okay, so no cutting corners when it comes to lens care. It sounds like there's a lot to remember.
There is, but it's all about establishing good habits to keep your eyes healthy. Your eye doctor will go over everything in detail, and they're always there to answer any questions you might have.
That's good to know. I'm guessing cost is a factor for a lot of people when considering contact lenses. Are they a big investment?
Well, the costs can vary depending on the type of lenses, the brand, and whether your insurance covers any of it. Daily disposables might seem more expensive up front, but you don't have to buy cleaning solutions and lens cases.
True, so there are different factors to consider there. What about regular eye exams? Are those still necessary if you wear contact lenses?
Absolutely. Just like you need regular checkups for your overall health, your eyes deserve the same attention. Even if you're not having any problems with your vision or your contacts, it's important to see your eye doctor regularly.
How often are we talking about?
It depends on your individual needs and any existing eye conditions, but generally, at least once a year is a good rule of thumb.
So even if you feel like everything is fine, it's still important to get those checkups.
Exactly. It's all about preventative care. Your eye doctor can catch any potential problems early on and make sure your lenses are still fitting properly.
Okay, so we've covered a ton of information about contact lenses, from the different types and how to choose the right ones to the importance of proper care and those regular checkups. I feel like we've really laid a good foundation here.
I agree. It's a lot to take in, but hopefully you're feeling more informed about the world of contact lenses now.
Definitely. Now, before we move on to the really exciting stuff, the future of contact lenses and all the amazing things they might be able to do in the years to come, why don't we take a quick break? We'll be back in a flash to continue our deep dive.
Sounds good to me.
All right, so we're back and ready to dive into some of those exciting advancements that are shaping the future of contact lenses.
Yeah, this is where things start to get really interesting.
So we briefly talked about smart contact lenses in the last part. Can you tell me more about those? Like, what are they exactly?
Well, think of them as contact lenses with superpowers. They're basically lenses embedded with tiny sensors and microchips that can monitor all sorts of things in real time.
Wow, so it's like having a mini computer in your eye.
Pretty much. And the potential applications are mind-blowing. For example, researchers are developing smart lenses that can track glucose levels for people with diabetes.
Oh, wow, that would be incredible.
Yeah.
No more finger pricks.
Exactly. It could revolutionize how people manage their diabetes, and that's just one example.
What else are they working on?
Well, there's research into lenses that can monitor intraocular pressure, which is crucial for detecting glaucoma. And they're even exploring lenses that could deliver medication directly to the eye.
Like time-release medication.
Yeah, exactly. It could be a game changer for treating certain eye conditions.
That's amazing. So it's not just about seeing better anymore. It's about using contact lenses to manage and even treat eye diseases.
Right. And the possibilities go beyond just eye health. They're looking into lenses that could monitor vital signs like heart rate and even body temperature.
So it's like having a wearable health tracker, but it's right on your eye.
Exactly. And the data could be transmitted wirelessly to your doctor or to an app on your phone, so you could track your health in real time.
That's pretty futuristic. Now, what about vision correction itself? Are there any advancements happening there?
Absolutely. Beyond the health monitoring stuff, researchers are also pushing the boundaries of what's possible with vision correction.
Okay, like what?
Well, imagine contact lenses with built-in zoom capabilities. You could magnify things just by blinking.
Whoa, that would be awesome, like having bionic eyes.
Right. And they're also working on lenses that can filter out specific wavelengths of light, which could improve night vision or reduce glare.
Those sound like superpowers.
Yeah.
Is this stuff years away, or is it something we might see soon?
Some of it is still in the early stages of development, but some of it is closer than you might think. There are companies already working on prototypes of smart lenses for glucose monitoring and other applications.
Wow, so the future of contact lenses is looking pretty bright.
Pun intended.
Maybe, haha. But seriously, it's really exciting to think about all the potential these technologies hold.
I agree. It's a rapidly evolving field, and I can't wait to see what they come up with next.
Now, speaking of the future, you also mentioned augmented reality lenses. I have to admit, I'm really curious about those.
Oh, yeah, those are probably the most sci-fi sounding of all the advancements.
So what are we talking about here? Like seeing holograms in front of you?
Well, not quite holograms, but pretty close. Augmented reality lenses would basically overlay digital information onto your field of view.
Like imagine walking down the street and seeing directions pop up right in front of you.
Exactly. Or you could be looking at a menu and see a translation in real time. Or imagine playing a video game where the graphics are projected right onto your world.
That's wild. So it's like those AR glasses you see, but it's all happening right on your eye.
Yeah, that's the idea. And since contact lenses are so small and unobtrusive, it could make for a much more immersive and seamless AR experience.
I could definitely see that. So are we talking about something that's 5 years away, 10 years away?
It's hard to say for sure. The technology is still being developed, but I think it's safe to say that AR contact lenses are definitely on the horizon.
I can't wait to see what they come up with. So we've talked a lot about the future, but let's shift gears for a minute and talk about some practical considerations for people who are thinking about wearing contact lenses today.
Okay, sounds good.
Once you've chosen the right type of lenses and you've learned how to care for them, what are some tips for adjusting to wearing them for the first time?
Well, first of all, be patient. It takes a little time to get used to having something on your eyes, so don't expect to be a pro right away.
I remember when I first started wearing contacts, it felt so weird, like I had an eyelash stuck in my eye.
Yeah, it's a strange sensation at first, but most people adjust pretty quickly. One thing that helps is to start slowly. Don't try to wear them for hours on end right off the bat.
So maybe just an hour or two at a time and then gradually increase it.
Exactly. And make sure you have some good lubricating eye drops on hand. Dryness is a common complaint, especially when you're first starting out.
Oh yeah, I used a ton of eye drops in the beginning. What else can people do to make the transition easier?
Well, obviously, follow your eye doctor's instructions carefully, both for putting the lenses in and taking them out, and for cleaning and storing them.
Right, we talked about that earlier. No cutting corners on the hygiene stuff.
Exactly. And listen to your eyes. If you're feeling any discomfort, redness, or blurriness that doesn't go away, take your lenses out and give your eye doctor a call.
Okay, so be patient, start slowly, use eye drops, and follow the care instructions.
Got it. Now let's talk about the actual process of putting in and taking out contact lenses.
Okay, yeah, that can be a little intimidating for some people, especially at first.
I remember my first time. I was so nervous, I almost poked myself in the eye.
Yeah,
Yeah.
yeah, it happens. But honestly, it's all about practice
Mm.
and finding the right technique that works for you.
Do you have any tips or tricks that you share with your patients?
Well, one common problem people have is keeping their eyelids open wide enough. They kind of have this natural reflex to blink or close their eyes when something is coming near.
Oh, yeah, that's me for sure. A good trick is to use one hand to hold your upper eyelid up and the other hand to hold your lower eyelid down. That creates a wider space for the lens to go in.
Okay, that makes sense. And what about taking them out? Any advice for that part?
Again, it's about finding a technique that works for you, but generally you'll want to gently slide the lens down to the white part of your eye and then pinch it between your thumb and index finger to remove it.
Okay, so slide down and pinch.
Got it.
What if the lens gets stuck? I've heard stories about them getting lost behind your eye.
Oh, no, that's a myth. The anatomy of your eye makes it impossible for a lens to get lost back there, but it is possible for it to move a little out of place, especially if you rub your eyes a lot.
So what should you do if you can't find your lens or if it feels stuck?
First, don't panic. It happens to everyone at some point. Try using some lubricating eye drops to moisten the lens, and then gently feel around your eye to locate it. If you still can't find it, call your eye doctor.
Okay, so don't freak out. Use some eye drops and call for help if you need it. Good advice. Now, let's talk about some of the common discomforts people experience with contact lenses. What are some of the things that new wearers might encounter?
Well, dryness is probably the most common one, especially in the beginning. Contact lenses can sometimes interfere with your natural tear film, so your eyes might feel a little dry or irritated.
What can people do about that?
Using lubricating eye drops can definitely help. And there are also lenses specifically designed for people with dry eyes.
Okay, good to know. What about blurry vision? Is that something people should be worried about?
It can happen sometimes, but it usually just means the lens is dirty or out of place. Make sure you're cleaning them properly and that they're sitting correctly on your eye. If the blurriness persists, give your eye doctor a call.
Makes sense. What about redness or irritation?
A little bit of redness is normal when you're first getting used to contact lenses, but if it's persistent or if you're feeling any pain, it's best to take your lenses out and contact your eye doctor.
So basically, anytime you're having any kind of discomfort that doesn't go away, it's best to err on the side of caution and get it checked out.
Exactly. Better safe than sorry.
Now, are there any specific habits that people should avoid to minimize discomfort and potential problems?
Absolutely. Number one, never sleep in lenses that aren't designed for overnight wear. We talked about that earlier, but it's worth
Yeah,
repeating.
that's a big no-no.
And don't reuse disposable lenses. They're meant to be worn once and then tossed. And always follow the recommended replacement schedule for your lenses.
So no trying to stretch them out to save a few bucks.
Exactly. It's not worth risking an infection or other problems.
Okay, so good hygiene, follow the rules, and don't sleep in the wrong kind of lenses. Anything else?
Well, just be mindful of your environment. If it's really dry or dusty, use eye drops more frequently. And if you're spending a lot of time staring at screens, make sure you're taking breaks to rest your eyes.
All good advice. It sounds like a lot of it comes down to just being aware of how your eyes are feeling and taking care of them.
Exactly. It's about being proactive and making eye health a priority.
This has been so informative. I feel like I've learned a ton, even though I've been wearing contact lenses for years.
Me too. It's always fascinating to dive into this topic. There's always something new to learn.
Now, before we wrap up, I wanted to touch on something that I think is really important, especially with all these advancements happening in contact lens technology.
Oh, what's that?
The ethical considerations.
Yes, that's a crucial point.
We talked a little bit about it earlier, but I think it's worth delving into a bit deeper. For example, with those smart contact lenses that collect health data, there are some big questions about privacy and security.
Right. Who has access to that data? How is it being stored? These are things we need to think about carefully.
Exactly.
Yeah.
And then there's the potential for bias in the algorithms that analyze that data. We need to make sure these technologies are developed and used responsibly and ethically.
I completely agree. It's not just about the cool factor. We need to make sure these innovations are benefiting everyone and not exacerbating existing inequalities.
So it's a conversation we need to be having as these technologies continue to evolve.
Absolutely. We need to be thinking about the ethical implications alongside the scientific advancements.
Well said. Okay, I think we've covered a lot of ground today, from the basics of contact lenses to the mind-blowing possibilities of the future. I'm so glad we had this deep dive together.
Me too. It's always a pleasure to talk about this stuff.
Before we wrap up completely, I want to take a moment to recap some of the key takeaways for our listener.
Great idea. It's a lot to take in, so a recap is definitely helpful.
First and foremost, we learned that contact lenses has come a long way. There are so many different types and options available now, so there's really a lens out there for almost everyone.
And it's important to remember that contact lenses are medical devices, even those colored ones. So always get a prescription from a qualified eye care professional.
We also talked about the importance of proper care and hygiene. Clean those lenses, store them properly, and never sleep in the wrong kind of lenses.
Absolutely. And listen to your eyes. If something doesn't feel right, take your lenses out and call your eye doctor.
And then, of course, we explored the exciting future of contact lenses with all the potential for smart lenses, augmented reality, and who knows what else they'll come up with.
It's a really dynamic and innovative field, and it's going to be fascinating to see how it all unfolds.
Now, before we say goodbye, I want to leave our listener with one final thought to ponder. Given all these advancements we're seeing, what kind of impact do you think contact lenses will have on our lives in the years to come? How will they change the way we see the world, literally and figuratively? Until next time, keep exploring.
Okay, so we're back for the final part of our contact lens deep dive. It's been quite a journey so far, right?
Definitely, we've covered a lot of ground.
So before we wrap up, I wanted to circle back to those specialty contact lenses we touched on earlier. The hybrid, ortho-K, and scleral lenses.
Oh yeah, those are really interesting ones, each with its own unique benefits. Exactly. So let's break them down one by one, starting with the hybrid lenses. I remember you mentioned they kind of combine the best features of soft and RGP lenses.
Yeah, that's right. They've got that rigid gas permeable center, which can give you super crisp vision, like some folks get with RGPs. But they also have a soft outer skirt for comfort.
So it's like having the best of both worlds.
You got it.
Yeah.
And they're especially good for people with irregular corneas.
Okay, back up a sec. irregular corneas?
Yeah, so basically it means the cornea, that clear front part of your eye, isn't perfectly round. It could be from things like keratoconus or even certain eye surgeries.
So if your cornea isn't perfectly round, light doesn't enter your eye the way it should, and that's why you might need a special kind of lens.
Exactly. And with those hybrid lenses, that rigid center helps to create a more consistent surface for the light to pass through. So even if your cornea is a bit irregular, you can still get really clear vision.
Makes sense. So hybrid lenses for irregular corneas. What about those ortho-K lenses? The idea of reshaping your cornea overnight still kind of blows my mind.
I know, right? It's pretty cool. So those lenses are specially designed to gently mold the cornea while you sleep.
So you wake up, pop those lenses out,
Hmm.
and you can see clearly all day long without glasses or contacts.
You got it. Now, it's important to remember the effects are temporary, so you got to wear them every night to keep that vision correction going. But for a lot of folks, that freedom from glasses or contacts during the day is totally worth it.
Oh, I bet. Especially for athletes or anyone who's super active.
Definitely. They're a game changer for lots of people.
Okay, so we've got hybrid lenses for irregular corneas, ortho-K lenses for freedom from daytime glasses or contacts. What about scleral lenses? Those are the ones for specific eye conditions, right?
You got it. Scleral lenses are kind of unique because they're much larger in diameter than regular lenses. They actually vault over the whole cornea and rest on the sclera, the white part of your eye.
So they're like a bigger, more protective type of lens?
You could say that. And that design makes them super helpful for people with certain conditions affecting their cornea or the area around it. Think dry eye, corneal transplants, things like that.
Makes sense. So they basically create a smooth, moist surface over the cornea?
Exactly. They can be a real lifesaver for people with those kinds of issues.
This is amazing. It's incredible how contact lens technology has advanced to address so many different needs.
It really is. And who knows what the future holds, right? We might have lenses that can do even more incredible things down the road.
Right. Bring on those augmented reality lenses.
I'm with you on that. But hey, even with all these advancements, the most important thing is still finding the right contact lens for your individual needs and lifestyle.
Absolutely. And that's where having a good relationship with your eye care professional comes in. They can really help you navigate all the options and make sure you're getting the best fit for your eyes.
Couldn't agree more. They're your partner in this whole process.
Well, I think we've covered just about everything there is to know about contact lenses, from the basics to the future and everything in between. It's been a fun deep dive, wouldn't you say?
Definitely. I always enjoy talking about this stuff. It's a fascinating field.
Me too. I've learned so much, and I hope our listener has too. So for everyone out there who's thinking about trying contact lenses, or maybe just wants to learn more about them, don't be afraid to ask your eye doctor all the questions. Explore those options and find the perfect fit for you. And remember, keep exploring, keep learning, because the world of contact lenses is always changing. Thanks for joining us on The Deep Dive. Until next time.